Community Health Network is well known for our unparalleled patient care. What is less known is that much of what we do is made possible through private financial support from patients, families, and businesses in our community.
All hospitals and clinics are looking to expand their ability to take care of people who are sick and injured. And it's important for those outreach activities to get the financial backing they need to be successful.
People often contribute as a result of their exceptional healthcare experience.
I walked in the first day for this appointment. The guy doesn't know me from Adam. I don't know him at all. My experience was there wasn't another patient on his docket for the rest of the day. That's how I felt. He sat, we talked, we got to know each other, we laughed, we talked family history. I felt like I could have been with him literally all day.
Well, I think it's because they didn't just invest in us as patients, they invested in us as people. It's a vulnerable time. You don't know when you might go home, you don't know if the children are going to be okay, and they never made us feel like our questions or our needs were inferior to anybody else's, and that made all the difference.
My father had a heart attack, and his first point of treatment was at Community East, and I've always attributed the care that they gave him to saving his life. There was a nursing assistant came in, and my father hadn't received a shave in 3 or 4 days, and she said, "We're just going to clean your pop up." And she just got down and lathered him up and shaved him. And when we go to make gifts, we think about her as much as we may think about the physician that we're providing care for him.
The care, the concern, the attention, it's a little bit of a deeper feeling than just a service is rendered. It's that the caregivers become a part of your life.
The Community Health Network Foundation offers a team of fundraising professionals who work with patients and families to help them find meaningful ways to express their gratitude. However, as good as they are, they cannot do it alone.
Most healthcare professionals get thanked every day in some form or fashion, but there are levels of gratitude. Some people are saying, I'd like to make something better in this hospital that will help others who come after me because I'm grateful for what this institution has done for me and my family. And I think that's therapeutic.
We as a healthcare team are uncomfortable with that because that's not what we do on a day-to-day basis. And I hope that changes because for me, being able to give back was a huge part in my healing process. It makes you feel like you're still fighting the battle in a good way because you're helping others.
Really, I tell my patients all the time, it's about you. This is your experience. You tell me what you need. And I don't think any differently about philanthropy in that regard either. So if I hear words of gratitude or if I develop a connection and hear that a patient might be very interested in how they can serve others, then I think it's my obligation to make the appropriate referral so that maybe we can make their dream come to fruition.
Even when a patient thanks me now, I make sure that I stop and look them in the eyes and let them know how much that meant to me because I know that they're thanking me because it means a lot to them.
As members of this healthcare team, part of our job is to nurture the philanthropic process. To understand the impact of philanthropy is to ensure a healthy future.
I think it's our responsibility to offer the opportunity to people who want to thank us in ways that they're not sure how to thank us. This foundation is very active and does very incredible things for people. So everyone has to be involved.
People often do want to do more than bake cookies. They want to be more involved. They want to give. But we can be the conduit who connects that person with the foundation.
Join us as partners with the Community Health Network Foundation. Together, we can build a culture of philanthropy to continue serving our patients with the excellence they've come to expect.
It's hard for me to think about community and not think about philanthropy. It's who we are, it's how we were founded, it's how we were started. Even though we've grown and, expanded in leaps and bounds, Without philanthropy, without a culture of giving, we aren't community.
What little I have, I still want to be able to help someone else. Thank you so much for giving me an opportunity to be able to be a part and to help someone.